Are you pregnant and wondering why do you need so many antenatal checkups? Well, let me explain this to you. Now remember, pregnancy is a constantly dynamic and a changing condition wherein your health and your baby's health needs to be monitored time to time in order to pick up any red flags and manage them before they trouble you. The first checkup with the doctor should ideally be done when you miss a period. This is the time when you go to the doctor, they will do your general examination and they will prescribe the antenatal vitamins or the prenatal vitamins. These consist of folic acid, multivitamin, and a nausea vomiting prevention tablet to keep you in the best of health. We also do certain basic blood tests which comprise the antenatal profile. It includes tests like your basic blood count, your blood sugars, the blood group, serology tests to rule out infections like HIV, hepatitis B, syphilis, and we also do the urine test and a rubella test. In the ultrasound, we do what is called as an early pregnancy scan, and this is to identify the location of the pregnancy, make sure that it's a viable pregnancy, and to rule out what is called as an ectopic pregnancy. Also, if you find that the pregnancy is lagging behind, we can give medications in order to reduce the chances of missed abortions. What happens next? When the pregnancy reaches the 12-week mark, we typically do two tests. That is called the NT scanning and the double marker test. And this also includes a Doppler screening to see if you are at risk of developing high blood pressure in pregnancy. The double marker test and the NT scan are done to check for potential risk of having a baby with Down syndrome, which is a chromosomal disorder which can cause mental retardation in the baby. And then the next set of tests typically happen in the 5th month. Here we do what is called as a glucose challenge test to see if you have a risk of having diabetes, and we do the anomaly scan to evaluate the baby head to toe and rule out any potential anomalies or defects in the baby. At 7th month and 9th month, we do the growth scans, and we also do the basic blood tests like the hemoglobin, sugar, and a urine test to see if your hemoglobin is maintaining well and to make sure that you're not developed gestational diabetes. As far as the checkups are concerned, they typically are done on a monthly interval till the 7th month, and then they're done every 15 days till the 36 weeks, and then they're done on a weekly basis till you deliver. So when you go to the doctor, it provides them an opportunity to evaluate you properly, evaluate your symptoms. For example, a simple symptom like increased itching in pregnancy can be a potentially dangerous situation. Some people have what is called as intrahepatic cholestasis of pregnancy, wherein the enzymes increase in the liver and they can cause bile acid stasis, and this can cause problems in the baby. So much so that it increases the risk of having intrauterine fetal deaths and stillbirths. So even simple things need to be brought up to the doctor so that they can take corrective measures and you can have a safe pregnancy and a safe delivery. I'm Dr. Suman Singh, Senior Obstetrician, Gynecologist and IVF Specialist at Rainbow Hospital, Banagatta Road and Mansi Clinic, BTM Layout.